President-elect Donald Trump has rolled out new cabinet picks, including the head of Health and Human Services, Robert F. Kennedy Jr., his choice. Well, the announcement prompted a lot of backlash from a number of health advocates because of Mr. Kennedy's stances on vaccines and the FDA, among other things. Well, Donald Trump's sticking to his choice at an event last night. Listen.
We want you to come up with things and ideas and what you've been talking about for a long time, and I think you're going to do some unbelievable thing. Nobody's going to be able to do it like you, and boy, does he feel it in his heart.
So a reminder for our viewers, whoever leads Health and Human Services becomes head of Medicare, head of Medicaid, the safety of food and medicine in our country, the Centers for Disease Control, and the NIH, one of the world's leading medical research centers. Those are some powerful levers to have your hands on. CBS News medical contributor Dr. Celine Gounder joins us now to break this all down. Okay, so this is a lot to digest, right? This department oversees a wide range of agencies that affect the real lives of millions of Americans. What kind of power would Kennedy Jr. hold if he's nominated and confirmed by the Senate?
Well, it's important to understand there's a difference between the power of political appointees and then the power of civil servants. So your career, quote unquote, bureaucrats.
Right.
And the difference is that the political appointees are really in charge of aligning the strategies and priorities of HHS and the agencies within HHS with those of the administration. Normally, your career scientists, people who have expertise, technical expertise, are the ones that are digesting the science, making recommendations to the HHS secretary, who then weighs those recommendations based on policy priorities.
Okay, so lawmakers are voicing their concerns about this pick because of his stance on vaccines. I mean, that's just one of many headlines. He has said, quote, "There's no vaccine that is safe and effective." So what's the reality here?
The claims that vaccines cause autism have been completely debunked. And to be very clear, vaccines do not cause autism. The doctor who was behind that research, quote unquote research, had his medical license taken away because there were issues with the ethics of that research. The research was sloppy and unfortunately has also led to many kids dying from measles and other vaccine preventable diseases, including in America Samoa, where RFK Jr. did push the anti-measles vaccine agenda, unfortunately to the death of many children there.
So Kennedy's also said that one of the Trump administration's first acts will be the work of removing fluoride from drinking water. Why is he so fixated on fluoride?
It's a great question. Fluoride prevents dental cavities. And while high levels of fluoride, the kinds of levels you might find in China or India or Ethiopia, where it occurs naturally, those levels of fluoride that have been found to be toxic in those settings are 30 to 40 times higher than what we have in our drinking water here in the United States. That's number one. Number two, it's not actually in the power of HHS to make that decision. The CDC makes recommendations about the use of fluoride, and the EPA, which is not part of HHS, sets maximum levels of fluoride in the water, what is considered to be the maximum that is safe. Again, those are levels that are extremely low compared to the levels where we see toxicity. One crucial fact here is that many people also misunderstand that most public health powers are at the state level. We are the United States of America, and that's really where the power to make decisions about mandating or using fluoride are made, and whether it's at the states or sometimes the states will let local jurisdictions decide for themselves. That decision is not made by the federal government.
You're a doctor. You talk to a lot of doctors. You're connected to doctors all over this country. Bottom line, what do you think the resounding voice is going to be from our nation's medical community to Mr. Robert F. Kennedy Jr., who is now going to have a lot of power?
I think the biggest concern is whether science will continue to drive policymaking or whether decisions will be made based on politics and emotions. There are some of RFK Jr.'s policy priorities, such as regulating ultra-processed food, may in fact be healthier for the American people. But again, this will really depend on whether Congress empowers him and the FDA and others to do this, and whether Congress funds them to enforce any regulations they might pass. And so We know that the Republican Party has tended to be anti-regulation, pro-industry. Susie Wiles, the new chief of staff to President-elect Trump, has been a lobbyist for the food industry. And so we really don't know which faction within Trump's political orbit will win this battle.
All right, Doctor, thank you so much for that conversation. I think it's an important conversation. Probably the most important conversation that can be had, though, is between the patient and the doctor right there in the doctor's office. We appreciate you so much. Be well.